As a Palestinian who have lived many wars, the May offensive was the most brutal. The sheer brutality and the sheer violence that happened was actually the most vivid memory that I recall, including the 150 bombs that were fired in the vicinity of my neighborhood. So you can imagine how terrifying that experience was to me as a Palestinian and to my family.
I was able to see the bombardment through my windows. Every day I thought, perhaps the following day is going to be the day when I wake up under the rubble. So it's still there in my memories.
The health system has been described by the World Health Organization and many other entities as a collapsing health system. If you are taking a health system that is collapsing and add to it COVID-19, add to it May offensive and the many ongoing escalations that people don't know about, then this means that you are already exhausting the health system and taking away from the already scarce resources that are available. The focus during the May offensive was shifted on trauma and emergency care related items, but this meant that other categories like cancer patients, like hemodialysis patients and other non-communicable diseases have been neglected, and this was a direct effect of the May offensive.
From the first day of the offensive, MAP has coordinated with the health cluster in order to mobilize our prepositioned drugs and consumable items to hospitals. And we knew that there is lack of resources needed for the health personnel in order to save the lives of people. Unfortunately, I don't feel much better from last year because I still think that the situation is very volatile and insecure for us. As long as the blockade is still on Gaza, I think that any minute we can go back to those days we lived in.
I feel that nothing has changed, but I wish for the best, and I hope that every Palestinian would have their health and dignity maintained for as long as they live.